Yes. Now, one of the things that I'm really kind of confused about, and please help me with this, and in terms of the pre-existing conditions,
Hmm.
uh, I I know that, and I, as an attorney, one of the things I saw when I was doing personal injury law, and we're talking about a good 20 years ago, but the insurance companies were always trying to avoid paying, and they would always go and pull up this pre-existing condition denial.
Hmm.
And so you mentioned about, well, okay, fine, we should have pre-existing conditions. So if we yank Obamacare or the Affordable Care Act,
Hmm.
if we yank it out, this, just turn it off somehow,
Yeah. Hmm.
what happens to the pre-existing? How do we grandfather that in without having an idea as to how we pay for the rest of the system?
Let's go back to number four, portability in a free market system. If the insurance policy stays with the individual, then if that individual leaves their employment, the insurance policy stays with them, and the insurance companies can't say, well, we're not going to insure you anymore when you get to your new employer because you have a pre-existing condition. Look, I've lived this. My wife had breast cancer when we left the military, and my new company wouldn't insure her, so we had to keep our old insurance. Fortunately, we were able to do that under the system we were under, and that's what I think we need to be implementing is this portability concept so that folks can keep their insurance and go ahead and continue to pay their premiums and get treatment for their folks, for their families, and that's what will address the pre-existing condition issue, because if we leave it in a big federal program, eventually the bureaucrats are going to take hold, and they already are, on the decision-making criteria instead of doctors and patients.
Okay. Now, insurance companies, I mean, did take over, as far as I'm concerned, in terms of, I've seen so many times, and I'm sure you have also, where a doctor says to a patient, okay, we want this treatment, and the insurance company says, no, you can't have this medicine the doctor has ordered, you can't have this, you can't have that. So, are we taking the burden off the, say, government and just keep, putting it back onto the insurance companies whose obligations, and not that there's anything wrong with it. I mean, this is free enterprise, and
Mm-hmm.
their obligations to their shareholders. But
Mm-hmm.
it's not we're not going to have a perfect system no matter what. We didn't have it before. And we don't want to have at least I don't want to have a single payer system, which is, like you said, a Bernie Sanders
Mm-hmm.
type system.
Yeah. Again, though, that gets into insurance policy and reform and that kind of issue versus why do we have to have a big federal government program that forces people into a certain type of policy. An example is a friend of mine that works over in Hammond. He operates a small business. His spouse is in a corporation where she has her own medical insurance, and he has his own medical insurance through his small business. Well, his policy was canceled by Obamacare because without even asking him, because he didn't have maternity insurance on himself through his private business insurance policy. And those are the kinds of situations that we need to prevent from happening, and the only way to do that is not have government health care. We need to reform our insurance laws. You know, the insurance companies all like Obamacare because of one thing. It takes the risk from them and puts it on the federal government. But it's not really on the federal government. It's on the U.S. taxpayer is who's taking all the risk on that. And we need to shift that risk back to the insurance companies and have them operate as private businesses, not these public-private partnerships or as part of a government healthcare system.
Now, some might argue that Obamacare, in many ways, is like Medicare. I mean, the thing is that everybody pays into the system in terms of Medicare if they're working, and once you reach a certain age, then basically, the government pays. So, what are the differences? And in fact, in terms of Medicare, let me just throw some out. As I understand, I mean, like you may have you may have a private enterprise system, that actually will take over the administration and the payment of the claims. Now, in many respects, isn't that kind of like Obamacare?
I think it's totally different. Obamacare is the very next step on towards a single payer system. Just look at all of the issues and the dollars that we spend on things like websites and those kinds of things. We've spent almost $1 trillion just to get a website working, and it still doesn't work effectively today.
Yeah, that was a disaster.
Yeah, it is a disaster, and we throw numbers like $1 trillion around as if they're nothing, but they're our tax dollars, and that's the issue. Medicare. The last time I looked at my pay statement when I was earning a paycheck, there's a payment where I paid in to pay for my Medicare coverage when I get to that certain age and those kind of things. And nobody's paid into Obamacare, so I think it's a totally different system, and it's one that's taking the risk off of health insurance companies and putting it on the U.S. taxpayer, and that's the wrong way to go. Because, like I said, instead of spending all these dollars on trillions of dollars on websites, we could have spent those dollars on medical research to cure cancer and Alzheimer's and diabetes instead of having these high costs go up.
Okay, now look, that's fair enough. I think this is a debate that we're going to have, as we continue. Whether no matter who who takes over, say the Senate, the House, and President, is going to be an ongoing debate.
By these 4 youngsters, and tonight you're going to be twice entertained by them, both right now and again in the second half of our show. Ladies and gentlemen, here they are, the 5